What if you suddenly needed to visit the emergency room,
stay in the hospital overnight,
or have surgery?
Without health insurance, you could owe tens or even hundreds of thousands of dollars for medical care.
For that reason, and for your benefit, UAB students are required to have health insurance to reduce the risk of high debt from costly medical bills and unforeseen illnesses or accidents.
It is important to understand how the U.S. healthcare system works and know common insurance terms so that you can be prepared when seeking healthcare.
Let's break it down step by step.
The U.S. healthcare system is composed of providers, hospitals and clinics, insurance companies, and you, the consumer.
When you are ill or need medical advice, you most often visit a primary healthcare provider. The provider may recommend preventative measures, diagnose and treat you for a condition, recommend further testing, or refer you to a specialist.
After your appointment, the hospital or clinic will file a claim with your insurance on your behalf. This is a bill that summarizes your visit and is based on the medical services provided.
Later, you may receive an explanation of benefits, or EOB, from your insurance company. An EOB is a document that summarizes the claim that was processed.
Your insurance company will pay the clinic for some or all of the services in the claim based on your individual plan. Often, services are less expensive when a provider or clinic is in-network or has a special cost agreement with the insurance company.
It's a good idea to check that a provider is in-network before scheduling an appointment.
Most insurance plans require you to pay out of pocket for a portion of your care. This is called cost sharing. Examples of cost sharing include copays, deductibles, and coinsurance.
A copay is an amount that your health insurance plan requires you to pay for a specific medical service or prescription. For example, your health insurance plan may require a $15 charge for an office visit or prescription drug. One benefit of being enrolled at UAB is that you don't owe a copay for office visits at the Student Health Services Clinic.
A deductible is an annual amount that you have to pay towards the cost of your care before your insurance plan pays.
Coinsurance is the portion of the cost of care that you are responsible for after paying the deductible. For example, a 20% coinsurance means that you pay 20% and your insurance carrier pays the remaining 80%. But remember, coinsurance doesn't always apply to all services.
It is important to know how much each of these shared costs is in your plan so that you can be prepared for the out-of-pocket expenses.
For more information about the current UAB Student Health Insurance Plan, the student insurance requirements, and additional educational materials, visit uab.edu/students/health.